Good afternoon. Welcome to day 275 at the EMA office. Joined with the chairman, Mark Kern, and Barb Hope from the health department. Barb, you have the numbers and a little bit of information for us today.
Absolutely. Good afternoon, everyone. We have the updates for day 275 today. In St. Clair County, we have tested a total of 181,476 individuals. That's an increase of 1,871 tests. Of those, 179 were positive, including males and females under the age of 1 up to the age of 90. That makes total number of positive cases at 17,959. And today's daily positivity rate was lower, thank goodness, to 9.6%. So let's keep that up and keep working on bringing that positivity rate down. Therefore, that makes a total of 163,517 tests that were negative. Unfortunately, we have an additional death in St. Clair County to report today. It was a female in her 80s with unknown healthcare conditions. That makes a total of 290 deaths in St. Clair County since this started. And again, as Herb and others have said, this has become personal to us. We've all known of family members and friends that have experienced this disease or even died from this disease. And last night, one of my lifelong friends, her sister died from COVID with no underlying health conditions. So my thoughts and prayers go out to her family, as well as these 290 individuals that have passed away from this COVID. It's real, and we all need to get together as a community to help control this virus. We have 15,388 folks that have completed the IDPH required 10-day isolation period. Statewide, we have tested 11,776,832 individuals. That's an increase of 7,216 tests statewide. Of that, that makes a total of 848,904 that have tested positive. And unfortunately, in the state of Illinois, we have lost in the last 24 hours 115 additional individuals due to COVID-19 illness, for total deaths in Illinois of 14,291. And again, our thoughts and prayers go out to all of those. Hospitalization numbers in St. Clair County hospitals. Today we're reporting 103 patients with COVID-related illness, and of those, 8 are on ventilators. Region-wise, we're still up there in the 200s. 213 patients in the regional hospitals with COVID-related illness, and 15 are on ventilators. Again, our hospitals are very, very overwhelmed and are working to take care of all these individuals. Our thoughts and prayers and support goes to all those healthcare workers. In the congregate living centers, we have 2 additional cases to add at the Mercy Rehab and Care Center in Swansea for a total of 52 cases and no deaths. At Sycamore Village in Swansea, we have 1 additional case for a total of 22 cases and no deaths. And finally, at the Freeburg Care Center, we have 1 additional case for a total of 18 cases and no deaths. Again, as far as testing sites, 7 days a week, we're at St. Clair Mall from 8 to 4, Monday through Friday. And as Chairman announced last week, very soon we'll be offering COVID testing clinic here provided by the county at 330 West Main. And we'll have more details as soon as we can get those open. We will get that information to you. So with that, sir, I will turn it over to you.
Great. Thanks, Barb. Let's take a look at the zip codes. In 62059, we go up 1 today. 62201, we go up 4 to 433. 62059 is 32 now with that increase of 1. 62203 is up 1 to 449. 62204 is up 2 to 293. 62205 up 7 to 448. 62206 up 6 to 876. 62207 up 3 to 419. 62208 up 9 to 1,021. 62220 up 25 today to 1,244. 62221 up 22 to 1,674, and 62223 up 11 to 1,078. 62225 stays the same today at 90. 62226 up 25 to 1,935. 62232 up 13 to 593. 62239 up 1 to 264. 62240 up 1 to 92. 62243 up 9 to 403. 62254 up 6 to 553. 62255 up 2 to 47. 62257 up 3 to 194. 62258 up 7 to 667. 62260 up 4 to 437. 62264 up 3 to 209. 62269 up 19 to 1,886. 62282 up or stays the same at 44. 62285 is up 8 to 348, and 62289 stays the same today at 27. As Barb said, 179 new positives in the county today, with 1,871 people tested. That brings our daily county positivity to 9.6%, which then allows us and brings our 7-day rolling average to 11.8%. We haven't been that low since November 8th, so 11.8 and 11.8%. So the mitigations are working. We've just got to keep things going. We certainly have to drive that number down much farther than what it is, but we are making progress, and we're finally back to the numbers that we had before the Halloween spike hit us. Regional positivity, this is the state's calculation. As of today, it's down to 13.1%, reflected by Bond County coming in at 16.8%, Clinton County 11.6%, Madison County 18.8%, Monroe County 2.8%, Randolph County 12.7%, St. Clair County 10.2%, and Washington County clocking in today at the high again of 29.3%. Herb, question and answer day, huh?
Yes, sir. Question and answer. Brian Whitaker, Assistant Director, will do the honors of reading the questions as they came in. Brian?
Thank you. We'll start with Director Holt with the Health Department questions. The first one that come in says, if staying indoors to eat is unacceptable, how can some wineries and other restaurants have enclosed tents? Isn't that the same as being indoors? They finish by saying, by the way, thank you for being with us for 275 days or what feels like years. Stay safe.
Thank you very much for that. And yes, some days it does feel like years, but we are starting to see the light at the end of the tunnel here. Wineries and other restaurants can stay open and have outdoor dining in tents as long as two sides of the tent are open. Those are the rules. So as long as two sides of the tent are open, that is considered outdoor dining.
Okay. The next person says, how many PCR cycles are the tests run through, and why isn't Illinois disclosing this information like they started doing in Florida?
Again, as far as details on the actual PCR testing, I would refer you both IDPH and CDC website. Not a lab expert by no means, but digging into the details of how many cycles and the basics of or the details of how these tests are being run, please follow up with CDC and IDPH.
Okay, the next person asks, how active is contact tracing in St. Clair County?
We have 30-plus staff that are working 7 days a week on trying to keep up with all the contact tracing. Our priority is to reach out to the cases and advise them of their isolation and especially their household members, and then get in touch with their contacts. So we have several folks working very, very hard, 7 days a week to follow up and contact all the cases.
Okay. A hot topic today is about vaccines. I'm going to read through several parts of questions here and let you go ahead and give a vaccine update on these. People wrote, can you provide a timeline for vaccine distribution in Illinois to include essential workers? Another person said, since hospitals will be getting vaccine this week for staff, will they begin immediately giving it to patients? And do they have the ability to store it for the future? Do you know the high-risk people, like those with diabetes and MS, will they qualify for the vaccine? Questions about how long the immunity will be for vaccine. And a very popular question, can I ditch the mask after I've had both shots?
Okay, thank you. I have a lot of new information fresh from FDA and CDC that I would like to read out to you to make sure I try to cover all the questions. But as you well know, Pfizer was approved for their vaccine for COVID-19 by FDA, and it's called a EUA type of approval, meaning emergency use authorization. And what that means is that FDA, since this emergency with COVID pandemic, that it allows the declaration that circumstances exist to justify the use of emergency drug products such as Pfizer's COVID-19 vaccination. So with that, these are not, it's approved as a EUA, emergency use drug. It's not completely approved by FDA at this time. That's Pfizer's, but it is approved for use in the human population. This is not a mandated vaccine. I checked with several hospitals. They are not requiring their staff to be able to get this vaccination. Again, what's happening in St. Clair County, we expect to receive the vaccine, our first shipments this Wednesday, and those will be going to the priority populations, which at first will be the hospitals for the medical providers, the nurses. One of the questions asked about, will patients receive this? And not at this time. The vaccine is intended for the medical providers. It is a vaccine. It is not a treatment for the patients. So patients will be, more rules and regulations are coming down and guidance for how soon you should be able to receive the vaccine after you've had and recovered from COVID. A couple other things I would like to highlight. Again, it's your choice to receive the vaccine. I think the chairman said earlier in the week, do your homework. Do your homework and read up on the vaccine. And there are several locations, cdc.gov, IDPH is putting up information on the Pfizer, specifically the Pfizer vaccine. And as we said, Moderna is another vaccine that's coming to FDA for their EUA approval as well within these next few weeks. The Pfizer vaccine is administered in a 2-dose series, 21 to 28 days apart. So they highly recommend getting both vaccinations. Through their studies and research so far, if you get only the first vaccine, it's only 50% efficacy. They highly recommend and encourage everyone to get both shots. It has to be, let's say when Moderna comes out, we have Pfizer now and we have Moderna. You get the vaccine from the same provider. So if you get Pfizer first, 3 weeks later, 21 to 28 days later, you're to get the Pfizer vaccine at that time as well. This is a lot of tracking of information for individuals, so any provider that it will be giving out the vaccine is required to be registered in what is called ICARE, I-C-A-R-E. It's our statewide, state of Illinois system that keeps track of all the vaccinations. So we'll have your name, what type of vaccine you received, and what date you received the vaccine. So then we will be able to look you up and know 21 to 28 days what vaccine you should get. We'll also, when you receive your first vaccine, you'll be given a card to say the date and the type of vaccine you received, and then the 21 to 28 days later to come and get your second dose. Again, the first round is going to what we call phase 1 individuals, those high priority healthcare and long-term care facility workers, and I can kind of read a list of who that will be. So healthcare personnel are defined as paid and unpaid individuals serving in healthcare settings who have the potential for direct or indirect exposure to patients or the infectious materials. So that can include the clinicians, such as physicians, respiratory therapists, dentists, and hygienists. Other workers include EMS, our emergency medical services personnel, ambulance, nursing assistants, environmental services, those folks that come in and clean the hospitals and the rooms, assisted living facilities, their staff, long-term care staff, group home care staff, and home caregivers. Again, the long-term care facility residents are defined as adults who reside in the facilities that provide a variety of services, including the medical, personal care, and those to persons that are unable to live independently. So that is phase one. Again, the shipment that we will receive on Wednesday to go to these hospitals to be able to be distributed to these individuals is not enough to cover everyone. We will be getting shipments on a routine basis that we will be distributing to this group in 1A to work through the process and make sure they all get vaccinated. 3 weeks later, FDA and IDPH has a schedule that we have reserved that amount of vaccine, so the individuals that receive the first shot will have vaccine available to get the second shot 21 to 28 days later. So again, a lot of information is available on the IDPH website, CDC website. We have links on our website to give further details. A couple other things that I do want to highlight. Again, we feel that through this process, the general population in St. Clair County should be able to get this vaccine generally March, April, May. Again, it's a process, and getting a first and a second shot, so we need to make sure our medical providers and our emergency personnel. A second phase B1, it goes to first responders. They will be the police, the fire, those essential workers, those critical workers are in that group. And then from there on, we'll be able to move into the general population, prioritized again for target populations. Those are at high risk. Does it seem like a lot of work and a lot of figuring this out? It is. But again, we're working with our community partners, the hospital, EMA, and other the Walgreens and the pharmacies, CVS, to help distribute this vaccine as quickly as we can. Again, this is a 2-dose injection. There have been, you probably have heard that there have been a few in the United Kingdom where they gave some immunizations that there were some side effects. Again, we watch the individuals after you receive your shot. We will make sure we stay in contact with you to let us know if you have any type of side reactions or anything to this. But generally what they're saying is a sore arm, typical things that you get from a vaccine. Finally, so who should get it once we get to the general population? At this time, a lot of questions about if I'm pregnant or breastfeeding. Again, discuss that with your healthcare provider. You cannot get COVID-19 from the Pfizer COVID vaccination. This does not contain the COVID virus, so you cannot, it's not a live virus vaccine. So again, just like the flu shot, you cannot get the flu from the flu shot. You cannot get COVID from the COVID vaccination. So those are highlights on a lot of information there about vaccine. But as we get more and as we have more vaccine available and which group we're going to be providing the vaccine to, we'll make sure we give you those updates.
Thank you very much. The next question says, tonight we were doing grocery shopping at a few places and also ordered dinner from a place to bring home. All places were not following recommendations. At Ruler Foods in Fairview, a mom, dad, and child that was maybe 11 all had no masks on. When I got to the register, I asked them if they were mandatory, and the employees said they aren't allowed to say anything to them. The cashier said this particular family comes in almost daily and will not wear masks. When I did our carryout for dinner, not a single employee was following guidelines. I'm assuming the person in charge had no mask on, along with 2 employees, and then one had one that they wore under their nose, and the other all the way down to their chin. It was sad for me to see parents not leading by example for their children, and the business for not supporting the guidelines as we're trying to support them and keep them in business. The point is, how do we continue? Are stores doing this so there's no trouble to their employees? Shouldn't everyone know the rules by now?
I totally agree. We will follow up with this specific facility that you had mentioned, but again, parents need to set an example for their children as well. And employers need to ensure their employees are properly wearing masks, and that the facility, depending on what type of facility they are, follows the Tier 3 mitigation guidelines. We are all in this together, and as a community, we need to follow those rules to help control and use the tools we have at this point in time to control the COVID virus spread.
And Barb, wearing the mask, it isn't just to protect themselves or that 11-year-old child. It's to protect others from them passing the virus to them. It's far more effective if both parties are wearing masks. So it's like the vaccination. You know, I'm going to get that vaccination when it comes out. As much to protect myself as to protect others, you know, to protect my family and friends and people that I interact with. I want to make sure that I don't have the virus and that I'm not shedding that virus. This is really a community effort. As you said, this is all about everybody banding together to get rid of this virus so we can get our lives back to where they were 275 days ago. Good news is there's a lot fewer days ahead of us than there are behind us, it appears. So we'll be, that light at the end of the tunnel is getting brighter every day.
Absolutely, it is a community effort, and you're absolutely correct, sir, that it's a long tunnel, but there's a light there, and we're getting there. So as a community, we can get there faster.
The next person wrote, does the health department track reinfection rates for individuals? I'm assuming that some of the nursing homes are having reinfection incidents.
Reinfection rates are being tracked through the Salesforce, the database system, and that information can be obtained from Department of Public Health through our Salesforce and contact tracing statistics.
Okay, the next person says, if you are 6 feet or more away from someone indoors, do you have to wear a mask? What about outdoors?
Again, indoors, we recommend wearing a mask at all times. You know, if you're in your own office and doing your work alone, then you don't have to have your mask on. But if you're, you know, amongst a crowd, or you're anytime you get up to go at work to go to the coffee pot, do copies that you may run into someone else, we highly recommend wearing your mask, because there's at times you may not be 6 foot apart. You don't know who you're going to run into. Outdoors, again, depending on what the activity is. If you're going to be outdoors and walking a dog and not seeing anybody else, okay. But we can't encourage enough to wear the mask at all times if possible.
If you think you might have the virus, wear the mask, no matter where you are. And if you're in an environment where you think someone might give it to you, you wear the mask. If you're home and you're with your family unit and everybody feels very comfortable that they haven't been exposed, then you don't have to wear that mask at home. But certainly when you're out and someone can shed this virus to you, or if you think you can shed it to others, wear the mask. It isn't that tough a thing.
I totally agree. It's new for us, but it is just the simplest way and the easiest way we can help control this disease spread.
Okay, thank you. The next person, right? Is the health department aware that some schools, in order to accommodate more students, are putting plans together to seat students 3 feet apart instead of 6 feet apart? If the department is aware, is this something that is deemed as safe, or what actions should be taken?
Again, schools are governed by IDPH and Illinois Department of Public Health and ISBE, or Illinois State Board of Education, and they have guidelines, and their guidelines specifically state you need to do 6 foot social distancing for their students, if at all possible, as well as always wearing a mask. And there may be certain situations, depending on what the situation is, the student, if they have special needs, whatever the case may be, But if you have schools that you feel that are not following these rules, please let us know. We'll be glad to discuss this with the schools.
Okay, and the last question for the health department here that was submitted is, why is the barber shop next to me allowed to be open during a pandemic? They are packed all day and half the night.
The barber shops and beauty shops are allowed to be open. However, they're required that they can only have 25% of their capacity in the facility, and everyone must be masked at all times. So even when you're getting your hair cut, you need to wear your mask. Things such as, getting your beard trimmed, gentlemen, or your mustache or something like that. Ladies or gentlemen getting facials, those are not allowed because you can't wear your mask to be able to do that. But barbershops and beauty shops are allowed to be open. Employees and patrons must wear their mask at all times and no more than 25% capacity. If you have a facility that's violating those rules, again, please call the health department and we'll follow up with that.
Thank you very much.
Barb, is it too late for a flu shot?
Absolutely not. You can always get your flu shot, and we highly recommend it, especially during this COVID pandemic, because we certainly don't want anyone to have dual illness at the same time. And the flu shot can't give you the flu. Neither can, once we have the COVID vaccine available, it cannot give you COVID. So please get your flu shots. They're available at several facilities throughout St. Clair County in the area.
Thanks, Barb.
You bet.
Thank you. We'll move to Chairman Kern for a couple questions that have come in. The first person wrote, how is enforcement being handled when it comes to the local city government outright saying the responsibility is not on them to enforce the rules? I've seen that locally in St. Clair County that there are mayors and police saying it's not up to them, but it's up to restaurants and businesses to know their risk, not to the city government or the police to enforce this. Yes, that's the message we get from you almost every day to report noncompliance to our local city officials, and that's why these business owners are continuing to do this, because we can't get our officials to stand behind us. What should we do?
So it's up to many entities to enforce these rules, to enforce these laws, the executive order, Illinois Department of Public Health's rules that have been put out. And so it's up to the state of Illinois to enforce. It is up to St. Clair County and the St. Clair County Health Department to enforce those laws. And yes, it is up to your local elected officials, your mayors, to enforce also. In fact, many times mayors have more powers than the state or the counties. The mayors have what's called home rule authority. Many mayors do. So O'Fallon, Fairview Heights, Belleville, East St. Louis, they're all home rule municipalities, which means that they can actually, they have powers that aren't given to anyone else. So St. Clair County is not a home rule authority. We don't have those special powers that allow them to have additional ways to enforce the mitigations. That being said, the mayors, in large part, have been very compliant and have tried to work on this. I would encourage you to continue to let them know if there are things that concern you, like people, have reported to the health department and to the county, to EMA. They do it every day, because you can't assume that the mayors know about these things. But really, it's up to all of us. It's up to the state police also to go around and make sure that these rules are being enforced. The mitigations are working. There's a reason why we're at a number today on our regional positivity that we haven't seen since November 8th. And it's because these mitigations are working. Whatever people want to say, they can criticize a lot of things, but I think the science is showing, and the numbers certainly are showing, that we're driving this rate down. Hospitalizations are still too high, but it really goes with what we've always said. The reason you don't use hospitalizations as your reason for going into mitigations is because by the time you get numbers as high as we have today, it's too late. That's why you use the positivity rate to show where you should be. So given the positivity rate of today, we expect to see hospitalizations start to go down because we're seeing the positivity rate going down. That is a leading indicator. The hospitalizations are not. They are what they are the day you get them. It's too late to try to start to drive those numbers down. You really need to work with your positivity rate.
Okay. The next one, kind of a follow-up to that, says, why are some counties in the area choosing not to enforce the mitigations? There are restaurants in New Baden on the Clinton County side that were both packed when I went in to get carryout.
Everyone needs to be enforcing these rules to drive those numbers down. There are way too many people in the hospitals. We remarked the other day, Tammy said that, it used to be that you had less than one death a day, given your rate. So it used to be when we were on day 275, like we are today, you were far below that on deaths. Now, we've got 290 deaths in St. Clair County on day 275. We have now risen above an average of a death a day in the county. Those are all things we've got to control. That's the reason we're sitting here. Drive this rate down, get rid of COVID, get it out of our lives, and keep as many people alive during the process that we can. That's the key.
Okay, the next person says, you've done well at answering the questions I've sent in. My question today is, why has Mayor Eckert never been on the briefing? And do you feel he should be invited to come and explain his action?
So all the mayors have been invited to be on the program. Many have throughout the 275 days we've been on. The fire chief from Belleville was here. He was one of our early guests and talked about the pandemic and everything that was to be expected. So everybody's been invited. Many have been on, and I think it's been a fairly successful process we've gone through for 275 days.
Okay, and the last person wrote, why did Mayor Eckert eat at Ragazzi's instead of getting takeout to help the area?
So I can't really necessarily speak to that. I don't know the facts, but Herb got carry out last night from a county restaurant. We did. We've had a number of carry outs. Barb did too. I can tell you that the food is just as good when you eat it at home. It may not be quite as convenient, and you may have to throw it in the oven, but man, we're making it work, and we encourage you to make sure you tip the servers, even though they're not waiting on you the whole time you're there. Make sure that the tip is equal or better than what you normally give. These places, we need them to be in business when we get finished. Certainly, we need to concentrate on, if we don't take care of ourselves, if we don't take care of our own restaurants in the area, nobody else is going to do that for us. You're not going to have people that are going to necessarily drive over from St. Louis to get carry out from an Illinois restaurant, from a Belleville restaurant. So let's take care of our hometown, our home county, and make sure that those establishments that are abiding by the rules, that are trying, that are really victims of this COVID virus in an economic way, as opposed to a healthy way or a health-related way, they are not responsible for what has happened to them. It is this pandemic that has hit their businesses especially hard. So let's concentrate on them, do what we can to make their lives a little bit easier. And the way we can do that is pretty simple and pretty enjoyable. Get carry out from your local restaurants and tip your servers.
And the food was pretty good last night.
It's great. It's great.
Just a couple of things on the numbers situation on our regional positivity. 13.1 today, which is down from the 14.0 yesterday, which is, as we said, it's always good going down. We like that. And Barb, I want to give condolences to your friend's loss. I know it's, and I want to just talk a minute, and we're running over a little bit here, but there's still some of the people out there, and I'm not talking about the members of Team St. Clair who have, for 275 days have busted their behinds to help spread the word. As you hear the chairman say, we're all in this together. But some of us haven't got on that boat yet, and that's fine. After 275 days, we've come to realize that no matter what we sit here and preach to you, you are going to have your mind made up. We have listened to every conspiracy theory out there. This virus was supposed to be gone the day after the election. Well, we're still here. And it's still going to be here until which time this vaccine gets here and we start getting it. So for Team St. Clair, continue to spread the word. Do your research, as we said the other day on the vaccine. There's a lot of talk about, well, I'm not going to get it, I am going to get it. Make up your mind. As you heard the chairman say and Barb say, it's definitely going to help get that light at the end of the tunnel brighter for us. We talked about the restaurants and the bars, questions about enforcement. The chairman, I think, pretty well said it. Each community is responsible. One of the questions on here this afternoon, why are strip clubs allowed to be open? Call those local authorities and ask that question to them. The county doesn't regulate them. So, we'll try to answer all those questions that we can, but we've answered those questions time and time again. So please just do your research, continue to spread the word, and we will get through this. We've told you. Yes, 275 days has been a long time, but no matter what you get on here and say, we are going to be here because we are committed to making sure that we end this invisible virus that we've talked about, the enemy, and we're going to do that, and we're going to do it together. We'll be back with Daisy in a few moments to translate this into our Spanish communities, and we'll be back tomorrow for day 276. Have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.